Associate Director of Medical Affairs at Sage Therapeutics, and I'm excited to share an overview of our clinical program perspective with you today. No, there's not. One second, guys, sorry. Just gotta get a clicker issue fixed. I can do that, sure. Yeah, okay. All right, so we're just gonna hear a few next slides of the presentation. Hopefully it won't take away too much. Thank you so much.
We had to break in Tony. Maybe she's gonna have to volunteer and fly in for this. We have to
Oh,
make sure
let's
we
give a
take
hand
little
to Tony. Arian spoke before us. You are an important speaker, and we're so glad you're here too. Thank you.
Thank you. And they're married.
Oh my goodness, how lucky are we? Thank you. Okay, if you don't mind, when you're ready, next slide. All right, so I must disclose that SAGE-718 is an investigational compound that has not been approved by any regulatory authority for any use. The safety and efficacy of SAGE-718 have not been established, and there is no guarantee that the outcome of these studies will result in approval by a health authority. Next slide. Okay, so for our time together, this is what our agenda is going to look like. I'm going to tell you a little bit more about our company, Sage Therapeutics. We're certainly going to discuss Huntington's disease cognitive impairment. I'm going to tell you more about our prospective HD clinical development program, and very important, where to learn more. Next slide. So at Sage Therapeutics, we are a brain health company, and we are committed to developing novel therapies in brain disorders and neurocognitive disorders where there's a high unmet need, such as HD. We are headquartered in Cambridge, Massachusetts, just outside of Boston, with more than 700 employees currently. And our science is focused on two central nervous system receptor types, GABA and NMDA, both of which play a very critical role in how the brain processes information. Next slide. Now I just want to shift and discuss cognitive impairment and Huntington's disease. Next slide. But first, we have to discuss what cognition is. Cognition is the brain's ability to not only perceive, acquire, and understand information, but our ability to respond to that information. And it is our cognitive abilities that we use and to react and adapt in real time in a world that is constantly evolving and changing around us. Next slide. Right, for this slide, we need to understand what comprises cognition and cognitive function. Cognition is the sum of all of our mental abilities, and highlighted within these 6 circles on this slide are the key cognitive domains. 2 of these domains are most often impacted early, and those are learning and memory and executive function. Learning and memory describes our ability to take in information, file it away in our brain's internal organization system, and then be able to go back and retrieve that information at the appropriate place and time. Executive function is responsible for many things and describes the cognitive skills or mental processes that allow us to do things like planning, decision-making, working in memory, cognitive flexibility or flexible thinking, and inhibition as well. You know, these things are also needed to cope with challenges or new situations as we are presented with them. And while all of these domains must work together for us to function at normal capacity, it is executive functioning that is important in controlling our ability to plan, pay attention, remember information, and perform multiple actions at the same time. It's important to understand that cognition exists on a spectrum, meaning there are changes that occur over the course of all of our lives. Some of these changes are due to normal aging, and some occur due to disease that can lead to cognitive impairment and even dementia. In normal aging, anyone can experience cognitive changes, but when, and this does vary from person to person, that It becomes a concern to the individual without interfering with activities of daily living that it is considered cognitive impairment. However, even individuals with mild cognitive changes experience difficulties in day-to-day living at home, work, when driving a vehicle, or when communicating, for example. And this is particularly evident when executive function is affected. Once these cognitive changes affect multiple domains and become severe enough to interfere with everyday abilities, it's considered dementia. Cognitive impairment in HD is part of the disease process, and it is not a part of normal aging. Individuals with cognitive impairment may not present with symptoms, but rather observe changes in daily functioning, including difficulties performing complex tasks, changes in mood or social interaction, and even loss of employment. These factors, understandably, can be very impactful not only for the person, but for their families as well. Next slide. Okay, so now that we've discussed what cognitive impairment is, I really want to talk about the impact of cognitive impairment on the lives of those who experience it. Cognitive impairment can affect a person's mental well-being. Negative feeling towards oneself, anxiety surrounding many factors, and concern regarding what the future holds are just some of the issues that affect mental well-being and cognitive impairment. A person's physical well-being can be affected by early cognitive changes as well. Individuals with cognitive changes, particularly in executive function, may have difficulty managing medications which can worsen conditions they already have. The presence of pre-existing conditions may contribute to the progression of cognitive impairment to dementia, and this is more so if the pre-existing conditions are not well controlled or well managed already. And quality of life, which involves multiple aspects beyond cognition and includes social relationships, the ability to enjoy yourself and your mood and one's job, can be adversely affected early in cognitive impairment. In fact, individuals with cognitive impairment or early onset dementia have an increased likelihood of leaving their job due to the impact of symptoms on their ability to perform work-related tasks in the workplace. This slide provides actual feedback in their own words from individuals with Huntington's disease on how impactful these cognitive challenges can be, and just some examples of how people with cognitive impairment make more mistakes and their anxieties surrounding this fact. In the first bubble, the first individual said, "I'll do my job wrong, and then I have to redo it. Somebody may think I'm stupid and I don't know what I'm doing." Cognitive impairment can also lead to difficulty adapting to new plans and situations. Here in the second bubble is an example from someone who said it will take them almost 1 to 2 hours just to talk themselves into doing a task, and takes a long time to switch tasks. In this individual, in the third bubble, cognitive impairment has made meeting deadlines difficult, and this is because they find it difficult just to sit, type, and formulate sentences. And with many people with HD, like this individual in the last bubble, express their concerns with difficulty staying on task and how they get distracted so easily. These statements highlight just some of the issues a person with HD can face and how they can feel in these various situations. These are just some of the examples. Okay, next slide, please. All right, let's pivot to talking about our investigational product, SAGE-718, in Huntington's disease in HD cognitive impairment, as well as more about our prospective clinical development program. Next slide. So I'm going to give you an overview of SAGE-718. SAGE-718 is an investigational oral therapy, and we are evaluating it for its effect on cognitive impairment. SAGE-718, which is a positive allosteric modulator of the NMDA receptor, is thought to bind to that NMDA receptor, potentially causing an increase in neurotransmitter signaling or positive modulation of the receptor. SAGE-718 is being studied to understand its effects on cognitive function in HD. And it's important to know that NMDA receptors are involved in communication between neurons, mediating learning and memory, which we know is affected in cognitive impairment. Next slide, please. So this slide just shows you an overview of our Perspective program. Our Perspective program includes 3 trials designed to evaluate the cognitive and functional effects, safety, and tolerability of stage 718 in patients with cognitive impairment associated with HD. And completers, here on this supposed to be your left, completers of the phase 2 dementia and surveyor studies together with the de novo cohort of patients will be eligible to enroll in a phase 3 open label safety study, and that's called Purview, and I'll tell you more about that as we move along. Next slide, please. The first study in our Perspective program is our Dimension study. The Dimension study is being conducted to evaluate the effect on cognitive function in participants with HD. The objectives of the study are to evaluate Sage 718's effect on cognitive performance, daily function, and quality of life, as well as safety and tolerability. The Dimension study is currently enrolling, and we have a goal of 178 participants with a criteria that includes participants ages 25 to 65, with a definitive diagnosis of HD and a CAG expansion of 36 or greater. Participants must have cognitive and functional impairments, and then other health and eligibility requirements that your physician can go over with you. The time commitment for this study is 4 months, 3 months of treatment with 1 month of follow-up. The participants will be randomized, and one group will receive Sage 718 daily for 3 months, and the other group will receive a placebo daily for 3 months. During that time, both groups will have 9 clinic visits during which safety and tolerability will be assessed and cognitive and functional assessments will be performed. And participants, as I said before, in the Dimension study are invited to participate in our open label safety study review. Next slide. So we have 50 sites in the US, Canada, UK, and Australia for our Dimension study. This is a North American map. The sites in that orange red are sites that are currently enrolling, and the sites in blue are sites that are selected that are not currently enrolling, but they will be very soon. And travel support may be available for interested participants in locations where sites are not near you or not available to you. Next slide, please. Our Surveyor study, which is our sister study to Dimension, is being conducted to evaluate the effect of functional capacity in participants with HD. The objective of this study is threefold. We want to evaluate the difference between HD and non-HD or healthy participants in cognitive and functional performance. We want to understand the effect of Sage 718 versus placebo on cognition and function in HD participants, and then also to evaluate the safety and tolerability of Sage 718. Surveyor is currently enrolling with a goal of 80 participants, 40 of them having HD, and 40 of them being non-HD or considered healthy participants. The criteria is the same as Dimension. All of the 40 HD participants will be randomized 1-to-1 to either receive Sage 718 or placebo daily. The healthy participants will not receive any Sage 718 during the study, but will go through all of the assessments that the HD groups will. The study is shorter than Dimension. The time commitment is only 2 months, 1 month on treatment, and 1 month of follow-up with 6 clinic visits. In Surveyor, in addition to safety, tolerability, cognitive, and functional assessments, there are some additional ones as well that include, that allow us to evaluate the functional capacity and do a functional assessment, and those are virtual reality and driving simulator assessments that help us to evaluate how Sage 718 can affect real-world functioning in activities many of us do every day, like driving, shopping, making lists, running, errands, just for example. Like Dimension, all participants with HD from this study will be invited to join our open label safety study program. All right, so this is we have 14 sites in the US and Canada for Surveyor, and this is our map. Orange sites are the ones that are currently enrolling. Blue sites are selected, are not currently enrolling at this moment, but will be soon. And like dementia, and actually for all of our studies, travel support may be available for interested participants in locations where there's not a site or it's not close enough for you to get to. Next. And our purview study, this is our long-term open-label safety study to evaluate safety and tolerability of stage 718. The objectives of purview are to evaluate safety and tolerability of stage 718 and how stage 718 affects cognitive performance, daily function, and quality of life. And there will be 300 participants. As I mentioned before, completers of dementia and surveyor are invited to enroll in our purview study. And for purview, there will also be a de novo cohort with a different criteria to join the study. The criteria for the de novo cohort of purview is ages 25 to 65, CAG expansion of 40 or more, a CAP score of 90 or more, and then there are specific cognitive and functional requirements that your physician can go over with you. This is an open label safety study, and participants will receive stage 718 daily. This study will last at least 1 year, maybe more, with 7 clinic visits. And it's important to note that this study is planned to continue as long as safety and efficacy continue to support development of stage 718 in HD. This is our most current map of our purview sites. The orange ones are enrolling, the confirmed sites in blue have been confirmed. They're not currently enrolling, but they will. And again, like dementia and surveyor, travel support may be available for interested participants if there's a location that's not convenient or close to you. And I'll have information at the end on how to learn more. In fact, I think it's the next slide. Yes, so this slide, very important. Where to learn more, you can go to any of these sites. At the bottom, there is an email for questions, general study questions and inquiries, clinical trials inquiry at sagerx.com. You can find more information there. Also, the physician can give you more information on this. And my colleague and I will be sitting at that back center table right there. We will have our business card. There's Leslie. Leslie's waving and saying hello to all of you. That's my colleague. We'll be sitting there. If you have any questions during the break or anything that we might have to take offline or anything that you think of, we'll also have our business cards if you didn't think about it right now. And if you have any questions, we'll be sure to give you our business cards. Just want to say a huge thank you to Katie, Katrina, Health HD, and all of you. You are the reason we do this work. We cannot do any of this without you. We're so grateful. So thank you so much for your time.